Hi, and welcome to this clip where I hope to give you an overview of how we've designated different areas within the respiratory ED. So the entrance is now by the goldfish bowl and patients can register themselves as they enter. If they're ambulatory, then there's ambulatory chairs just past this to the right, with 3 assessment bays, A, B and C, just beyond that. This essentially hasn't changed from the old EAU model. Next door to the ambulatory chairs, there's a donning room where you can put on level 1 or level 2 PPE. Beyond that, we have 7 bays where we can offload patients who have arrived by ambulance, much like the RNA in our old majors between beds 2 and 5. If a patient has been pre-alerted and needs to be in resus, then we've got 2 areas for resus. We've got resus rooms which are dedicated for aerosol generating procedures, and these are bays 8 and 9, 18, 19 and 20. They're all side rooms to protect us as we go through an aerosol generating procedure. The aim is to use Bay 18 for patients who may require larger teams, such as a trauma team or possibly an obstetric case. If the patient is a resus patient but doesn't need an aerosol generating procedure on arrival, they can be offloaded into Bay A, where there is now 4 resus bays. If it turns out the patient does need an aerosol generating procedure, such as intubation, then they can be moved into one of the aerosol generating procedures just for this process. Beyond that, in Bay B, there are the equivalent of our majors beds, where we have 9 beds. Bed 30 is now X-ray, and next to that in bed 31 there's a side room, which I anticipate will use flexibly but could be for patients requiring palliative care. Next to that we've created a doffing room with an entrance door, which is the closest door as you approach, and an exit door into the clean environment. And if you are leaving respiratory ED and don't need to redon in level 1 or level 2 PPE, you can exit into the clean corridor, which runs behind both ED and respiratory ED. To get a patient to CT, it seems that the easiest route is to follow this same exit. So patients will come past the doffing room into the main corridor, turn left and travel up the corridor until you get to the main X-ray reception. Take a left through the sliding doors here, and then CT2 will be on your left. Here is a super sped up time lapse just to show the route for real. I hope this has been a useful overview to how the different areas work within respiratory ED, and also how not to get lost on the way to CT. Thanks for watching. I hope you hit subscribe. More videos will follow soon. Take care.